I want to ask you from a, as someone who is probably looking around cases that have been increasing, how much time or how much recovery time does it require after the surgery for a person to really carry on normal activities that you can carry on with a normal and with the joints that you're born with, for example?
Very important question. And so the best part is same day, both hips or both knee surgery done, we make them walk on the same day. That's the most advancement. And within 2 days, they climb the stairs. That's the ultimate uh, learning we give them. They take bath, they take walk, they climb the stairs, and then we discharge them. They go home walking, and they do have surgical pain that may remain from 10 days to 1 month, and but they are allowed to walk, bend the knee, because the scar, there is no magical pain. There's a pain which occurs after any scar. That pain always remains. We cover up with painkillers, and with the mobility, if they do exercise, the joint becomes smooth, the scar becomes smooth, the pain becomes less. So it is only for 4 to 6 weeks, and then it disappears, and they are absolutely enjoying their life. So yes, they do have surgical pain, which is not a magical, and we cover up with painkiller and physiotherapy. With modern, you need not require long-term physiotherapy. In the hospital, physiotherapy is enough, and their physiotherapy sessions are also less with robotic.
Right. So Dr. Bhosle, your specialization is hip and knee, but I want to ask you, is this limited only to hip and knee joints, or is this technique also usable in other joints?
Fantastic question. In fact, my hospital is full of robo. So we have liver transplant done by robo, cardiac surgeon done by robo. We have routinely do uh, uh, kidney transplant, uh, liver transplant. Everywhere the robo is a common thing, and it is really changing the patient rehabilitation faster, and the technology really causes best effect of the surgery. So it's spreading everywhere. And one important thing, onco also, the robo, onco and liver, the robo charges by the insurance is fully approved. So they should come down for joint replacement also. So for them, it is fully sponsored by insurance company. It is fully accepted. So one very important point, they should accept for joint replacement also.
Okay. You know, we are living in an age where we are scared of AI because it might just take away our jobs. What about robots? I mean, are patients scared that what are the, I mean, as a practitioner, I want to ask you, what is the scope for error in surgeries like this?
Exactly. So the most important part, it tells you pre-operative planning, and it will show you what errors can occur. And surgeon has got full control. Robo has one extra mechanism that is called haptic control. So if the saw or any tool, if it touches the soft tissue like blood vessel, now it will form an imaginary wall, and it cannot cross that wall. That beauty of the advanced technology is unique in the Robo. That's the most important thing. So it is a safety part which is very important, and that's why we really enjoy the safety part. It forms an imaginary wall. It cannot go beyond that wall and cut any soft tissue unadvantageously.
Okay, okay. And is this surgery once done and the joints once fitted, are they for a lifetime, or do they need replacement once again? What is the kind of after surgery care that you need to take, or the assurance that you have for the patients, sir?
Now, these are unlike cartilage, which is the lining, which wears out and which heals back. Artificial joints only wear out, no healing, but the technology is so gone ahead, it can last for 15 to 25 years. And with the robo, if the fitting is good, then it lasts further longer, So everything is correlated: best fitting, best longevity. And the technology of the implants which are available US FDA approved are much superior, and longevity is much better. So that's not a big fear nowadays. So 15 to 25 years easily they can go, and longer also with the robotic.
And there's no age group. Anybody in any age group can get it done.
Yes, we have anything with arthritis. Now I have operated 18 years old patient also. They have arthritis, they were disabled, and we gave them new life. And after 30 years, we can change it. That's a beauty. That's called revision. We can remove the lining, change new lining. That's called revision surgery.